Hello, welcome to this podcast where we talk about relevant health topics that matter the most. I'm your host, Dr. Radhika Vijayaraghavan, an endocrinologist at SPARSH Hospital, Sarjapura Road, Bangalore. Today we are shining a spotlight on a particular condition which affects millions of lives across India and globe, the diabetes. Today I have my colleagues, a team of specialists and educators who are going to talk about in detail the practical health tips, how to go about in terms of managing the diabetes in your day-to-day lives. While you are living with diabetes, or you are taking care of someone who is, or simply curious to know about how to prevent it, this episode is for you. Because being about the public awareness is not just about knowing, it's about acting, transforming and empowering just to have a very smooth journey with the diabetes. So if you are at home, just to grab a cup of coffee or tea, or if you are on the go, just to play it on and just listen to this episode, not with fear, but with the facts, hope and community. Hi Vani, just talking about the diet, which is $1 million question, isn't it? It confuses everybody. So what is a healthy way of eating for patients with diabetes? Is it any difference between diet for a diabetic patient to any other normal human being?
So it's all about balancing the food, right? So let's consider seeing a 9-inch plate, okay? So in that 9-inch plate, if you divide half plate with lot of non-starchy vegetables, which all the normal individual also to be taken, yeah? So non-starchy vegetables along with that 1/4 of protein and carbs. So when we talk about carbs, it should be complex carbohydrates that needs to be considered. So like taking brown rice or having whole grains, lentils. So these are the complex carbs that needs to be taken. So it is not that a specific diabetic diet kind of thing is really required. But yes, for certain conditions like diabetic nephropathy or if it is being affected to the heart or something, then a special diet is definitely required, because we need to look into the other aspects of the electrolytes and what is the water intake and so on. So a plate should be in this form, that half non-starchy vegetables with lean protein and complex carbs, and acceptable level of healthy fats is also very important. So like nuts and seeds adding onto it, or adding olive oil. See, basically in Indian cooking, olive oil is not highly recommended. So when you have salads, you can add olive oil for the mufa and for the fufa. So not really needed a very specialized diet.
Just breaking down into talking about the vegetables, where it is like the northern part of the country, they prefer certain type of vegetable, which is potato, and southern type there is a mixture of everything. How could you just put it out in a very simplistic, in a rememberable way, what are the vegetables?
So like I said before, non-starchy vegetables is basically comprised of having cruciferous vegetables like broccolis or cabbage, cauliflower, having lot of green leafy vegetables adding onto it, lot of beans. So these all are having good fiber plus vitamins and minerals. It helps to slow down the glucose release in the body. That helps the even the individuals to feel full. If you add that with a good protein in it, then you will not feel hunger every now and then, and that keeps your sugar levels intact. And avoid taking starchy vegetables, in particular the potatoes or sweet potatoes.
Yellow pumpkins,
raw
banana,
bananas and so on needs to be avoided, because the glycemic index or the sugars are quite onto the higher side. So definitely in the plate, we will not recommend to have it on a regular basis, but again it depends on the blood sugar levels. If it is very high, then we will definitely tell them not to consume it. But otherwise, in general, food has to be in moderation. You have to.
So you mean to say the portion control?
Portion control is very, very important. India is called as diabetes capital of the world. So Dr. Radhika, why do we see so much of diabetes cases in our clinic? What are the main causes for getting type 2 diabetes, in particular to our OPDs?
Yeah, that's a very important question. True, absolutely. We do see a lot of cases. It's to do with the risk factor profile has changed in the recent years with the significant changes in the lifestyle, the way we conduct our days, basically, with a target-oriented work-life approach and more sedentary life. That has been the major contributor to the most important type of diabetes, which is type 2 diabetes. That is, of course, there are several types of diabetes. In this particular one, where the lifestyle factors which are modifiable, and that has been having a huge impact on it. That's why we are seeing a lot of increase in the number of cases. Beyond that, there is something what you call epigenetic transformation, which has been happening over several generations. Because of that, our ethnicity population are much higher risk of developing it. So,
and that's very insightful news for the listeners.
Yeah.
Doctor, coming to the signs and symptoms.
Yeah.
See, many of the times it can be asymptomatic as well.
That's
so
right.
How do we pick it up?
Yeah, that's
how
very
do we
important.
Understand?
True. I think a majority of our public are aware of what are the commonest symptoms of diabetes, symptoms and signs, but there is a big bulk of patients which they go unrecognized, where they are asymptomatic. How do you frame it? Yeah, one advantage is looking at their risk profile. If they have a strong family history, that is whether they are parents or grandparents or first degree relatives, their cousins, uncle and aunts, they have the history of diabetes, better to go for the general health checkup. One thing what we have in our country is advantage of at our disposal, we can go to any kind of laboratory or hospitals and we can ask demand for the test, because we are spending money from our pocket. Through that you can identify whether we have kind of underlying condition. That's one thing. And recognizing looking into your family history profile. And the other group is women who has history of diabetes during her pregnancy, and young ladies with a history of a polycystic ovarian disease or with high BMI. These are all the people who are at risk of developing diabetes in the future. They are also advised to go for a regular checkups. This way they can recognize if it has been kind of happening underneath.
And how often do we need to monitor the blood sugars? Generally, type 2 diabetes, people will not be checking it very frequently, maybe monthly once or once in 3 months, or if they see that there is something wrong with their body itself.
That's right. Yeah.
So that's how they see it.
True.
And go and check it in a lab.
Yeah.
So how frequent that a person has to monitor the blood sugar levels?
So in terms of monitoring, checking, there are two ways of doing it. One is the traditional way is going with the 3 monthly blood test. That is, you have to go to the laboratory to get the test done, which is called HbA1c, or it called glycated hemoglobin. The other one is called a point of care testing or self-monitoring of blood glucose. That is using a glucometer. The other new advancement what we have is a continuous glucose monitoring device called CGM device, or the sensor, where we can put it on our body. It's a very simple and easy device. That is an advancement in the technology in terms of monitoring. This is very, very crucial. It's very important, where you can see any kind of abnormality, significant changes in your blood sugar by doing a self-monitoring of glucose at home. It is where you can recognize and seek for help.
Coming to the next question, you have spoke about the new advancement in terms of CGMs. So is there any new advancement with regard to the drugs? Is there any particular that a person has to look into after talking to a doctor?
Yes, absolutely. Yeah, in terms of advancement in the management of diabetes, one particular area in general in medical industry, and where there is a lot of research and advancement is happening, is the diabetes, this disorder, and the other one is the oncology, the cancer treatments. And we have seen in the last 2 decades, introduction of several molecules in terms of drugs, in terms of management, that is really making our life much easier. In olden days we had 3 or 4 types of medications, like including insulin. Now we have several, which has really not just controlling the sugars, they really transform the lives of the patients with the other comorbidities, what we call, like patients with a kidney disease or a heart disease or eye disease, like in these situations, and patients with a high BMI, that is being obese. These drugs really make a big difference in their lives. And when it coming to the technology aspect, like as I said, we have, like in terms of advancement in the monitoring of the blood sugars, and we also have advancement in terms of like the monitoring coupled with the medicine delivery, that is particularly in patients with type 1 diabetes, the insulin pumps. But when I say that insulin pump has advancement, but the research behind it has been going on for the 60 odd years or more. It's not something happened in the last 5 years before or 10 years before. So that's how it has been difficult. And with this amount of input in the research, now we have got insulin pumps, like which are just like a pager size instruments, which can automatically deliver insulin continuously, and also they can attach to tied up with the sensors, where they can talk to each other in terms of what we call it as like a bionic pancreas or artificial pancreas. This is particularly a big game changer in patients with the type 1 diabetes, particularly in children. Literally make their lives completely different and new. So it just, they are communicating with each other, where the sensor can recognize what is the level of sugar, and it can give instruction to the pump to deliver how much to deliver or when not to deliver.
Dr. Radhika, what are the major complications that we see in diabetes?
Yeah, that's very important. Yeah, the complications we can classify as like micro complications and macro complications, but that is basically classified vascular, that is to do with the blood vessels. So why do we have to really treat diabetes is to avoid this future complications of these sort, which is heart attack, stroke, losing eyesight with a blindness, and kidney disease, that end stage kidney failure, and to do with the non-healing foot ulcers, where it can end up losing the foot or the whole leg as well. These are the major complications. We have been talking about various aspects about the diabetes in terms of just to understand about it and how to recognize and prevent it. But I would say to conclude, what are the practical healthy tips? And very important, fundamental part is, as we were speaking about the healthy diet and how it should be approached. In addition to that is very important is the time management and the sleep and the stress management. It's very, very important, and coupled with the physical activity. Thank you very much, Vani, giving the insights about the dietary aspects and asking very relevant questions what all of us to be aware of, and particularly our patients.
Thank you so much to Dr. Radhika as well for inviting me.
Great.
And for me also it was a great understanding about diabetes and how to go it forward for the public.
Great. Thank you.
Thank you.